Morning, everyone. Thank you for joining us on Saturday. So I'm just going to talk a little bit about the chronic management of all these conditions we've talked about. And I suspect this is why everyone is here today with the hopes of avoiding seeing us in the hospital. Firstly, talking a little bit about aortic aneurysm risk factors. There are some things that we know about this condition that can't be changed, such as the fact that men are 4 times more commonly affected than women. Such as maybe a familiar face, Albert Einstein, and the NBA player Jeff Green. These are people that we have known had gone through aortic aneurysm surgery. But some of the things that we could possibly do something about, as already mentioned earlier in the talk, high blood pressure, so hypertension, which we know the numbers as demonstrated in the picture. We are aiming for a number less than 140/90. And why that is important is, as you can imagine, the aneurysm, which is like a balloon, is under pressure from the inside. And so when the pressure is higher, it increases the risk of disc growth over time. And of course, that increases the risk of tears as well, such as the condition called aortic dissection we've just talked about. Of course, if we know that something is already wrong with the aorta, we would then start to aim for slightly lower numbers as well. High blood cholesterol levels, I'm sure we all hear about from our GPs all the time. So what we know is that the bad cholesterol, called the LDL, is actually pro-inflammatory. So it causes an inflammatory condition in the vessel walls itself, whereby actually the good cholesterol, called the HDL, actually is protective. And all of this is actually hoping to reduce this process called atherosclerosis. Some of us might have heard of this before. And what that is there's a buildup of fatty deposits within the artery walls. And we know that that causes chronic inflammation and weakening. So this actually causes the same conditions that lead to heart attacks, called coronary artery disease. Dr. Sivaraj just briefly talked about the importance of family history. So having one family member, a close family member who have had an aortic aneurysm actually increases your chance of having an aneurysm in the lifetime up to 20 to 30%. So that is quite significant. And lastly, what we always nag about is smoking. We know that this actually increases the risk of aneurysms by 3 to 4 times. So why does this so? The aortic wall actually is very close in how it's formed to the lung tissue. And as such, smoking actually breaks down this tissue, causes weakening as well. And what we know is when we screened a whole population with no symptoms at all, we actually found that 70 to 80% of people who were found to have this problem of aortic aneurysms were actually either current smokers or previous smokers. So the longer you smoke, the higher the likelihood of developing such a condition. This also increased the risk of aneurysm rupturing as well. So moving on to prevention, I guess that we are really hoping to address those risk factors I just talked at length about. So avoiding smoking, diet, the kind of recommendations are similar to what we tell our patients with known hypertension. So we want to avoid salt, we want a high antioxidant diet, high consumption of fruit and vegetables, whole grains, avoiding excessive red meat and processed meat. I think this is guidelines that we're all familiar with. Exercise helps with control of blood pressure as well as cholesterol, but we do advocate avoiding very high strain activities such as weightlifting, because if we already know that there's a condition like aortic aneurysm or abnormalities that we're monitoring, and this is because that causes a little bit too much stress, a little bit too much blood pressure peak during these exercise. And why we're here today is because we know that this ongoing surveillance, this ongoing monitoring of this condition actually can save lives. So what we know is, as you can see, this chronic enlargement in size of the aorta actually is very directly linked to the risk of tearing, life-threatening conditions that can happen to this aorta. So below 4 to 5 centimeters, the risk is still reasonably low, 1% a year. But as we kind of progress beyond 5 centimeters, it goes to about 10% a year, and that's accumulative. And by the time it reaches, more than 6 centimeters, we're looking at about 50%. And that's why we've already briefly talked about the guidelines suggesting that we do something about the aorta once it passes about 5.5 centimeters, and that's the graphs that we've already talked about earlier in this presentation. So I'll just go quickly through it. So the next part of this presentation, we'll talk about the slightly less invasive options. Dr. Samia will continue on. Thank you.